Addiction, like heart disease, liver disease, hepatitis, HIV, doesn't look at class, age, race, gender. Addiction can creep up on anyone, anywhere, and any time, and from ways that you never would have imagined. Somebody just taking pain pills because they were in a car accident seems perfectly reasonable. Once you get addicted to a drug or alcohol, it's with you for the rest of your life. It's always going to be a struggle, hopefully less and less so, but it will be a struggle. There's going to be things in your life that will trigger potentially you going back to using drugs. For example, getting a paycheck on a regular basis, having disposable income, witnessing crime, seeing drug paraphernalia. Those are all things that can trigger somebody to have a craving. Our brains get programmed that when we see a particular object, we get a physiological reaction to it. Therefore, we're always going to be susceptible to going back to using drugs or alcohol.
People make a decision to use drugs, they don't make a decision to have those intense cravings that drives the addiction. What we're learning now from the neurochemistry is addiction is a disease of craving. We all have these types of cravings. If there was a dozen donuts in front of us, I'd probably have a craving for a donut. And with individuals with addiction, those cravings are even much more intense. We've put our emphasis into the drug use, and we've put our emphasis into making drugs bad, and drugs are evil. And it's really not about the drugs, it's about cravings, and that's where the medications are extremely effective. What it's doing is decreasing the cravings. Buprenorphine is not going to get a heroin addict high, it's going to stabilize them. The fact that we're discharging patients from substance abuse treatment programs is ridiculous with what we know about addiction and being a chronic disease. Yet we're discharging people and then we say, oh, it's a relapsing disease. Well, it's relapsing because we're discharging patients. We need to engage them for years, not just for months. And that's been one of our failures on our treatment side, to really look at making sure we're engaging patients for a much longer period of time. This is a chronic disease that we need to treat chronically. We're not going to arrest our way out of this chronic disease. It hasn't worked for the last 100 years, and it's actually made the problem worse. Healthcare reform gives us a really good opportunity to make a significant impact here by having more people have access to healthcare, ensuring that part of the essential health benefits that we have good access to substance abuse treatment, behavioral health treatment for individuals. On the federal level, we're not making access any easier. What we need more treatment out there. We need, more buprenorphine, more methadone to be available, but the federal requirements are so strong. Practitioners can't prescribe, buprenorphine. It's a medication that I could argue could be an over-the-counter medication. I mean, if we're really saying this is an epidemic, we really need to take a look at, how can we get better treatment out to individuals.
There's a wide variety of laws on the books today that really cause harm to people. What's called in our field the ban the box bill. And basically that bill says that if you've ever been convicted of something, there's whole classes of jobs, whole types of jobs that you simply are not allowed to even apply for. The ability to have a job, get a fair wage, is such a critical component to recovery. That's one piece of legislation that we'd love to get changed. Another piece of legislation concerns the NIMBY, or the Not in My Backyard syndrome. There are specific laws on the books today that do not allow mental health and substance abuse programs opening, despite the fact that they meet the zoning code for that particular area. Research has shown that there is less crime around drug treatment programs than convenience stores. Research has shown that when a program opens up, their main source of clients are coming from that very neighborhood. Not having a neighborhood substance abuse program or mental health facility to go to is a huge barrier for people that don't have cars, that have to rely on public transportation. We shop at our neighborhood grocery store. We need to be able to go get help from our neighborhood mental health or substance abuse program.
there are individuals out there who realize that they need treatment and aren't getting treatment because they don't think that treatment works. And so why do something that you don't think is going to work? I think giving people a glimmer of hope, I think is a very, very powerful thing. Helping people to understand that there's a way out.
By helping one woman, I wonder how many children that person has that now can live a better life. How many mothers and fathers can now be proud of their daughters. How many different ways that woman can give back outside of a paycheck, outside of the love they can provide their children, but to the story of resilience and hope that you can get better.